Good morning, everybody. Welcome to our Food Power webinar called 3 Wise Women, Lessons on Tackling Food Poverty from Food Power's Peer Mentors. Thanks for joining us. I was having a little bit of audio issues earlier this morning, so just to make sure that people can hear me okay, if you can hear me, can you just type over on the left-hand side of your screen, there should be an attendee chat. Can you just say what your name is and where you're listening from? If my sound's coming through okay. Great. Okay. Emily heard me from Shropshire. Fantastic. At least one person has heard me. Simon, fantastic. He's upstairs. Sounds good. Okay. Just to note, if you are having any connectivity issues, we often recommend using Chrome as a browser. If you aren't using desktop app for any meeting, and you can also type in any questions to the chat box because my colleague Simon, who's on the webinar, might be able to help you out. I'm just going to take us through a few housekeeping things and then we'll get into the content of the webinar. It looks like we've got a great group of people listening in from all over. Lisa's in Tower Hamlets, Richard's in Bournemouth, Jennifer's in Belfast, welcome. Emily and Sam are here who will be speaking, Gail and Devin. Wonderful. So thanks, everyone. So as you can see, we've got an attendee list and a chat bar on the left-hand side of the webinar. So if you have any questions or during the webinar, or if you want to share any information with other attendees, please feel free to use this as much as you want. It's public, everyone can see it, but I also try to repeat all of the questions out loud because we record all of our webinars and put them on our website. We welcome people to share contact info, project info, links. Often these webinars can be a good opportunity to connect with other people around the country or people working on similar projects or topics in your area. So don't be shy. At the top of your screen when you're listening in, there's a button that says Ask a Question. It's a green button. You're welcome to use this, but just so you know, that will send a question just to me and the other presenters. So if you want to ask anything in private, you're welcome to use that. But otherwise, we recommend the attendee chat on the left. As I mentioned, we record these webinars, and that includes all of the sound and the slides, and we'll post a link to it on our webinar page on the Food Power website in the next few days. And I'll email all the attendees a link to this once it's live so you can share it if you would like. I'll go through the agenda, but we find it best to answer most of the questions during the Q&A at the end of the webinar so that we can kind of have a little chat about things and maybe the different speakers want to chime in. So feel free to post your questions as we're going along, and I'll just take a note of them. So anything that comes up in the chat box that isn't just like, oh, can you send me the link to this? I'll take a note, and then we'll make sure to get to that during the Q&A at the end. So I'll just take us through who's joining us today. The idea behind this webinar was that we've got a set of peer mentors from around the country in Food Power. Someone recently asked if there was any way to kind of download a bit of their wisdom to the wider network because they often work just with alliances in their area. And so we thought, what a good way to wrap up 2019 than to gather some of that wisdom. And then I thought, 3 Wise Women, here we go. So Katie Palmer is joining us from Foodsense Wales. She's out in Cardiff this morning. Emily O'Brien is from Brighton and Hove Food Partnership down in Brighton and Hove. And Sam Dyer is from Cambridge Sustainable Food. And my name is Maddie. I work at Food Power, which is, just to fill you in a little bit about it, it's a UK-wide program. It's delivered by 2 organizations, Sustain, the Alliance for Better Food and Farming, and Church Action on Poverty. And we're funded by the Lottery Community Fund. And the aim of Food Power is really around strengthening communities' ability to reduce food poverty in local areas by looking at the root causes and local levers for change. So we work with about 50 local partnerships, what we often call alliances, that are based in different areas around the UK. Some are in cities, some are in counties, some are in small towns, some are just neighborhoods. We've been going for about 2.5 years, and a lot of what we do is trying to create this peer learning network to develop and share solutions among the different groups. We also offer financial support for alliances. We have regional learning networks that are often coordinated by our peer mentors, the one-to-one peer mentoring, a lot of resources on our website and advice from our national team. And then we also host webinars like this. So we encourage anyone to check out the website to see a little bit more about what we do. Before we get on to lessons from the peer mentors, I was trying to reflect a little bit about what have we learned at Food Power HQ over the last year. And I thought of 3 things that really jumped out for us. The first one's just about running the program that we do and around peer learning, I would say, which is a big part of our MO. And this autumn, we tried out something called peer challenge workshops, which is when groups that were going to apply for financial support from us all came together in advance of submitting their applications to present on their ideas and then get feedback and kind of be challenged by their peers on their ideas and hone them up. And it was something that was brought in by one of our colleagues who'd done this a lot with local authorities, and we're kind of like, okay, interesting to see how this goes. Will it be like a collaborative environment or a competitive environment, or how will alliances take this? Asking them to travel for a day to do this, and the feedback we got was really, really positive from everyone who took part, and they found it really useful to get input from groups that weren't just in their region, but maybe worked on similar things or could kind of like poke holes and ask questions and develop their ideas further. So one thing we learned is that peer challenges are really fantastic. We really like them, and we'd like to try to do more of them. So that was kind of some programmatic learning. In terms of the food poverty sector and some of our other work around working with people who have lived experience of food poverty, we found that we really need to get our thoughts and what we've learned about working on this in particular down in writing so that we can share it and with the people we work with and make sure that we're adhering by the same sort of guidelines and principles as well. So my colleague Ben Pearson is working on this right now, and hopefully we'll have a draft out to everyone in January. That's just kind of what have we learned is best practice for groups or alliances or food partnerships that want to work with people who have experienced food poverty. So stay tuned on that front. And then the third thing that kind of came up for us is around working as an alliance. Another key part of Food Power is kind of like we're trying to demonstrate the impact of working collectively on these issues around food poverty at the local level. And one thing we've really seen is that tangible and specific projects like Healthy Start, which is our annual theme right now for this year, have been a really excellent way to galvanize action across an alliance. Having something, Healthy Start is a food voucher scheme for pregnant women and young children and families who are on low incomes for them to buy milk, fresh fruit and vegetables, and first infant formula. And it's a statutory program, and the uptake is quite low. And so having a variety of actors come around something like this that's quite concrete, it's a specific thing you can work on, it's clear to monitor it, with some caveats on that because of the way data has been going for the last year. But generally speaking, it's a really, what we found is that alliances have found having a focus on something like Healthy Start has been an effective way to bring people together around a table and have set a common goal. So that's a little bit of what we've been thinking about in 2019. Not everything we've learned, but a few highlights. So I'm now going to pass over to Katie, who's in Cardiff, who's going to talk a little bit about her experience over the last year.
Hi everyone, from a very wet, cold, dark, damp Cardiff. It's absolutely foul here. Yes, I'm from Foodsense Wales, which is basically a charity looking at or influencing how food is produced and consumed in Wales. We work with Food Power and we're the peer mentors for Wales. We also deliver work through the Sustainable Food Cities network. I'm guessing most of you have heard of Food Cardiff. We're also lead on the Peas Please work in Wales. We're working with Veg Power, and we're also delivering Food for Life get-togethers in Wales as well as wider kind of policy and advocacy work that we get involved with. So our success in Wales to date, this first slide really shows you the food poverty alliances. I've just realised we've got an alliance spelled wrong there in Wales. So we've got a south and north alliance, really driving work in very different ways. We also have a local alliance in Flintshire, which is in the north of Wales. We have the Cardiff Food and Poverty Group, which was in existence before Food Power, but has worked with Food Power on optimising household income, and I'll give you a bit more information on that in a while. And also the Merthyr Food Alliance, which is in the valleys, which is in one of the most deprived parts of Wales, which is a new alliance which has been set up through the Food Power programme. So as well as beginning to build that network, we've also been building broader interest across South Wales using the call to action document. This was a document that was researched and written through Oxfam Cymru, who have taken over the chair of the South Wales Food Poverty Alliance. So this is a nice example of a success story where Oxfam Cymru were involved in setting up the alliance originally with funding from Food Power, and have now taken ownership of that alliance to drive forward action. The call to action report was basically mapping a number of different aspects across the local authorities in South Wales, looking at everything from uptake of free school meals and healthy start vouchers, poverty and employment figures across those areas. And we've used that data really tangibly to talk to local authorities. We've really been building momentum then with some areas who weren't aware of the kind of local level data that was available to them. So there's a list there of places that are interested in doing further work and that have potential to develop alliances going on into next year. So our kind of more on the ground achievements, I've already mentioned that we've got this long-term commitment now for the South Wales Food Poverty Alliance, which is fantastic. And we've been using that alliance really to bring together lots of different areas in South Wales. And one example was bringing Pontypool down to Cardiff to come and have a look at the pantry pilot that has been set up in Ely in Cardiff. And that's a really successful pilot that, again, has been delivered through the Optimising Household or Family Income stream of Food Power. One of the other key achievements is developing food scheme training, which is a training package that's been developed in combination with dietitians in Cardiff and Vale and money advice teams. And this is to ensure that money advice teams and people who are working with clients in frontline circumstances have a good understanding of all of the different benefits and schemes that are available to people. So we still have relatively low uptakes of free school meals. In Wales, we have free breakfast clubs, and we have very low uptake of children who are eligible for free school meals taking up free school breakfast, for example. We've got the obvious same challenges as everybody else with Healthy Start scheme. So we've done a level 1 training, which is the basic training package, but we've also done a level 2, which is a train the trainer, so that we have key people within parts of Cardiff who can actually then train their teams up in this food scheme training package. I guess one of the lovely success stories is the work that we're doing in Merthyr. So we have a new alliance set up there, and actually the data that we generated through the mapping report was really useful. And they decided that they wanted to set to work straight away with Healthy Start, and they just did simple things. The housing associations are a very strong stakeholder in that part of Wales, and straight away they just went off and started putting posters up to advertise the scheme. And they've also tapped into funding to run holiday provision, and I think that's been strengthened by the partnership that's been developed through the alliance. And in Cardiff, we've had our bronze renewal through, but we've also just had news in the last couple of weeks that Cardiff Council have actually agreed to develop a food strategy of their own, which will contribute to the citywide Food Cardiff partnership. and we're hoping that there'll be sufficient resource put into that as well. But that's great to see that those alliances that we've made with stakeholders within Cardiff Council, such as the catering teams and the money advice hubs, will all be integrated into that Cardiff food strategy. So Maddie asked to say, well, what are your top tips for working with alliances? And I think one of the things that became obvious to me very quickly was that you go on your own journey, and I think you need to remember when you're setting out that everybody's at a different starting point, and that you need to bring people along on the journey and not dictate the final destination. And I think particularly in Wales, we have very different cultural contexts within different parts of Wales. So that's been very pertinent for us, really. I've also had experience of, alliances wanting lots of help and lots of support, but others just wanting you to give them a leg up and then to step back. And I think for me, that's been really important as well, that areas want to have their own ownership and maybe know that you're on the other end of the phone, but actually are happy just to get on with it. I think the bit about trying to get commitment from a host organisation is really, really important for the sustainability of the alliance. And I think having that are willing to drive the work of the alliance and ultimately have some kind of commitment to make that coordination part of their day job is absolutely key. And then this other aspect of data, I think data is really important, and there's a lot of data out there that I think some of us assume everybody knows about, but actually don't assume that local partners do know about some of the data that's available, or if they do know about it, that they've accessed it. Because I think that's been quite a wake-up call to me, and how valuable that data has been in bringing to life some of the issues, and then how they can use that data to put pressure on some of the decision makers. Agenda and tips for working within that context. I think trying to link anything into existing programs where you can to add value and aid sustainability is really important. So the food scheme training that I mentioned earlier, we've driven that through the dietetic teams and some of the programs that they're delivering, and we've driven it through the money advice teams where they already have responsibility for training up their frontline staff, and we've just brought a new element to their existing training. I think this bit about that we're constantly struggling with around the fact that we're mitigating the effects of poverty, and that food poverty is just one element of a far bigger picture. And so trying to develop solutions that are as downstream as possible, whilst appreciating that the actual factor is not really in our control. And I think this is why we like the pantry model, because it's a model that's contributing to the wider food system. In Cardiff, we're looking at how we can develop a local supply chain that sits around the pantry, and look at having a network of pantries in the city. The pantry is very much owned by the local community, and they feel empowered to be involved with it. We've connected it to our cookery programs. It's connected to money advice. It's got the same building's got a second-hand sort of a clothes shop that sells or gives actually uniform and that kind of thing. There's a Men in Sheds project. So there's all sorts of different things going on there. And then I guess the final one is kind of be strategic when you can. It's not always easy to be, but link the challenges and solutions to government and public health agendas to seek support. So I think an example of this is the Cardiff Council food strategy. So in Wales, we have a unique legislative environment where we have every what we call public service board has to produce a wellbeing plan. And what we've tried to do is to integrate some of these challenges around food poverty into that wellbeing plan, so that it then becomes somebody in the council's day job to make sure that those. Another example is the call to action report, where we're actually sent out the data for the local authorities and the report to all of the chief executives, leaders and directors of public health within each of the local authorities in South Wales to try and raise the profile of that report. Challenges, resource, always, again, trying to link to existing programmes and local agendas, and then how to. I think part of that is about showing best practice, showing what works, alongside presenting local data. And for us, I think I've touched on this already. You know, the different cultural context. Welsh language is you know, a challenge for us, and also the rural context. But also those things need to be embraced, and there's always people that are working within those areas that will know those local areas much better. And we found that, for example, the local health boards have been really instrumental in supporting some of that work. My New Year's resolutions. So I think just to continue to work collaboratively in Wales to showcase best practice, and to influence government policies and strategies. Oxfam Cymru have agreed to update the mapping report for the South Wales Food Poverty Alliance, this call to action report, and we will be supporting them with that endeavour. And to continue to support local areas with data, alliance development and action, with a particular focus to see if we can try and get some action in Mid Wales, which we currently don't have on the food to power front. So that's me. Thanks, Maddie.
Great. Thank you, Katie. I thought it was a good point you made around local data in particular. I remember hearing about one local alliance saying that they were talking to councillors who in their area who just didn't believe that food poverty existed in that region. And I think once you start working this, you're kind of like, how could that ever be? Like, it's so obvious. But for them, it was really about showing like very, very locally, like to that councillor's ward, different like mapping of food poverty in the area. And then the councillors were kind of like, oh my goodness, right, sort of thing. So I think you're right to bring up that not everyone, like the importance of it at the very local level, it can be more impactful than you might think, especially when you've kind of got your nose to the grindstone, as many of us often do. We're now going over to Emily in Brighton and Hove.
Hi everyone, this is Emily. I'm speaking from quite a sunny, actually, South Coast. I hope you're all doing well. Having been introduced as a wise woman, I feel I should probably be doing something Christmassy, like wishing you a happy Christmas. But actually, I'm probably feeling a bit more grinchy. So what I'm doing is, rather than sharing Christmas cheer, I'm sharing some ideas about what's worked for us this year. So the Brighton and Hove Food Partnership works in lots of ways and at lots of different levels. We've coordinated a citywide food poverty action plan. More recently, we've got quite an all singing, all dancing food strategy action plan that very much embeds food poverty at its heart. And we do stuff as well. We run a community kitchen and we do various projects around growing, those kinds of things. But as I've only got a very short slot, I was going to do a whistle-stop tour through 3 things that we found particularly useful this year, and which we thought might work in other areas, might be useful for people to learn from. So the first thing that I was going to talk about is our Healthy Start campaign. As Maddie said, Healthy Start vouchers are based on the old milk vouchers, which lots of people know about, but they also cover fresh fruit and veg. Unfortunately, uptake's really low right across the country. We were very lucky to get some funding from Food Power. Thank you, Food Power, to run a campaign this year. It was building on our earlier campaign and took a similar approach in some ways. So one thing we did was we updated a poster we designed previously, and we've asked people via our partners, it's run with other organisations, to display posters. So they've gone out to all the libraries, to all the schools, And we were particularly pleased this year that actually Brighton and Hove buses got on board, and they put a poster up in every bus in the city, which was a really nice way to reach people with small children who might be eligible for the scheme and not know about it. We also did a social media uptake campaign. But I suppose my top tip around what we've done this year was that we also ran a series of bite-sized training sessions for frontline workers and volunteers. And that's been like a really useful approach, I think, in terms of spreading the word and in getting people involved in the campaign. So what they were, oh, I can't see my slide. Oh yeah, I hope other people can. I can see mine now. So what they were half-hour training sessions, which we offered to people as part of their existing team meetings. So basically it was an offer we put out through email and through social media saying, would you like a half-hour session about children and families and food poverty? And embedded within that was quite a big focus on a healthy start, although it didn't actually say that on the tin. It was the main focus of the session. I think the thing that we learned from that was that actually that format was really useful. So some of the sessions, we ran 21 sessions. I've got another 2 to go. I hadn't planned to do that many. We just were really, really inundated with demand, despite doing very little publicity. I didn't dare send a second email out because I thought I'd get drowned in the end. But I think the format appealed because it was a half-hour session where we would come to you and we would run the session as part of your existing team meeting or staff meeting or volunteer meeting. So that format seemed to work in different types of organisations. So some of them, like the holiday lunch club place, that was just 3 people, 3 key people at it, whereas hospital dietitians, I think we had over 30 in the session. But it was basically it was a we come to you thing, and it seemed to work well for different settings. So that ranged from domestic abuse charities. We're going to be doing a session with midwives. We've done stuff with health visitors and food banks, a full range of different organisations, advice organisations as well, because as Katie says, they're really key. So firstly, I think, we were really pleased with the demand. And so that was my tip really, is that people like this half-hour sessions. It's a really good way to reach people. And then the feedback we got from them was really good as well. I thought they might have been a bit too short, but 98% of people said that they were just the right length. And the really useful thing, I think, was that people reported a big increase in knowledge. So knowledge about Healthy Start vouchers is quite low. Most people, the average score for when we asked people what their knowledge was beforehand was less than 5 out of 10. But then the average score by the end of the session was over 9 out of 10. So it was a really efficient way to share quite a lot of information. And I think the other nice thing about the sessions is they were quite interactive, and they gave people a chance at the end to think about how they could embed Healthy Start vouchers and awareness of them into their own work, how they could put it into their systems, any systems or checklists or procedures they have where they're working with their families, to see how they could make it part of what they do. So I think, as Katie said, to make it part of their job really and become a partner in the campaign. So that was a really good way of generating buy-in. My next top tip was, it's not quite as exciting because it doesn't involve anything on buses, but we worked with Brighton and Hove City Council to update the Joint Strategic Needs Assessment for the city. Now, if you don't know what a Joint Strategic Needs Assessment is, don't worry, because actually what it is a really important document for public health, but they don't necessarily get viewed hugely elsewhere. But amongst that kind of decision-making community, so public health, also I think health and wellbeing boards, decision makers and commissioners, basically, they're really important documents because they hold the information about the city or about your area, and they pick up the health needs. We're very lucky. We have a really good relationship with our public health that we've developed over many years, and that's always a lesson about good relationships, isn't it? It's give them a bit of time and keep going with it. We have a fantastic public health team who were willing to work with us on this. We had previously done worked with them on it's called a topic summary now, a JSNA topic summary, which basically is a new name for it, where it means it's quite a short JSNA. They also do these massive ones that are huge exercises with about 200 pages and loads of data, but this is just a summary version of what's out there. So we we'd done one previously, but this one is much better, I think. And part of the reason for that is because we worked with a student from the University of Brighton who was absolutely fantastic. She was doing a health promotion master's, and she basically did all the work. She was absolutely brilliant. So it was a really nice three-way partnership. She got a lot out of the placement as well, because she then saw some of the challenges around partnership working. You know, we're coming at things from one way, public health at another way. None of us have enough time, but also it meant that she had the time to really do it properly. I'm not going to go into great detail about what's in it, but I've put a link at the bottom of the slide, and I know Maddie will be circulating them, which has got a link to the JSNA, and it really is quite colourful and easy to read. And there was just one thing I'd pick out that was particularly useful, I think, for us, is that it was a chance to look at some of what's been going on over time. So we've been working for a number of years in trying to build a picture of food poverty in our city. And as Katie was saying, without data and information, nothing means anything in a way. We don't know, if we don't know it, if we don't have the information on it, we can't fix it, or people can say it's not a problem. So what this particular slide shows a question in our annual City Tracker survey, which has now been included since 2014. So we're able to do analysis over 5 years. And what's quite interesting is that the red on the left-hand graph, that red line, which shows people who disagree that they're going to have enough money in the next 12 months for their basic living costs, including food and fuel, that has stayed remarkably constant. So I think that by looking at it over time, we can see that actually this is actually quite, you know, not just a one-off. Actually, on a constant basis, 5 people in our city are having issues around paying for their basics, including food. And the other thing is that we haven't put the data in over the years, but it's also stayed very consistent over the 5 years. Is just how much more people, particularly those with long-term illnesses and disabilities, people in private rented housing, and younger people, how many more of those groups disagree. So it's over 30%, and that's again been consistent over time. So that's really powerful data, but mainly it was just to say it's really good to, although it sounds really dull, it's actually a really fantastic thing to work with public health on something like that, because now this is their data, it's not our data, it's not us telling them something, it's now in their world, in their job, and influencing their commissioning decisions. Okay, the third thing was just to build on what I said before, really. I mentioned how great that particular student was. We've worked with different students, though, and we've developed our links with both universities in the city and with researchers, and that's been a real project over the last year. But the simple tip that I was giving people to take away is one of the things we realised is we quite often get approached from students who are interested in our work, or from researchers who are interested in researching what we do, but it was never really stuff that was going to be useful to us. So it's really hard to put the time into stuff that we didn't need. So the big thing that we've done, it's very simple, but it's made such a difference, is we've now got a list of all the things that we would like researching. It's quite a long list. We don't think people will come forward to them all. But now when people ring up, or if we want to be a bit more proactive and go out to them, I have been going out to the universities as well, then we can point them at a list of stuff which is actually what we want. And I think a side effect of it was that we actually made us think about what do we want to know, actually, and try and hone it down a bit more. So again, if you want to look at it, there's a web link there which has got our list on it, and that's just been fantastic. So that's my sort of third tip, I think. I think that was my last slide. Oh yeah, I was going to add, you know, that it's helped having stronger links with researchers, and we did also get published in a journal, which was quite exciting, given that I'm certainly a non-academic, I'm a doer, but we've been very pleased to have had to be featured, I suppose, in research, and to have a bit of presence, because, you know, it's another way to get the message out there and to bring more partners on board. Sorry, I'm just gonna, that was accidentally went into Sam's slide there. So I should say, I forgot I was supposed to say my New Year's resolutions, but I have got a couple. One is I'm thinking about climate change as such an important agenda, but I want to make sure it works with the food poverty agenda. They're not separate. The second thing is keeping an eye on the national picture for instance, with Healthy Start, wouldn't it be nice if I didn't have to go around and tell people about this really difficult, hard to understand scheme, if we could just have automatic uptake, automatic sending out of those vouchers by the government, given they have all the information about who needs them. And then my third one is we're currently applying, as our Bristol, we're in the process of applying to be a gold sustainable food city. And food poverty is one of the aspects that we'll be featuring when we write up our bid. So my third New Year's resolution is to become a gold sustainable food city. Thank you.
Thanks, Emily. That's great. I like the. I really liked your New Year's resolutions there, and particularly the point which we see coming up a bit more around climate change and how. What are the ways in which issues related to climate change can be embedded within work on food poverty? Kind of what are those inroads in such a way that it's not a separate issue, for example. Also, it was funny at the beginning because you said, I'm going to be the Grinch, and instead of spreading Christmas cheer, I'll focus on what's worked this year. And it sounded a bit like a Dr. Seuss book to me. So thanks for bringing that in. We're now over to Sam in Cambridge.
Hi there, everyone. Hopefully you can hear me. I realised this morning I've got a very squeaky chair, so you must excuse me if my chair squeaks as I'm speaking. So what have we been up to? Well, similar to Katie and Emily Bratton-Hoband in Wales, we work through the Sustainable Food Cities Network as well as through Food Power. So very similar setup. Oh, thank you. We also deliver on lots of other projects, on City Council programmes. We have hands-on delivery through holiday lunches, cookery workshops. We've run Veg Cities programme last year, and I'm also a peer mentor for the Eastern region. Our Food Poverty Alliance was formed just over a year ago, and it really consists of frontline organisations as well as the City Council and representation from our County Council. And I think that probably is where we as cities sort of differ from maybe Brighton and Hove and from Cardiff is that we're Cambridge is really a district council, so the public health aspect often is not at the top of our agenda, or it's quite difficult to make inroads into that because obviously that is a county-wide authority, and it's very much looking outwards rather than where we are based in the city. Saying that, the City Council recently fully endorsed cross-party endorsement of our Food Poverty Action Plan, and so we're very pleased there. So what would be my top tips for a Food Poverty Alliance? Well, as I think that's already been covered, it's always great to have evidence-based projects that you can point to. So Healthy Start project, which we've been, we originally had some Food Power funding to do some of that work, and we then managed to get some more funding from a local funding part, Cambridge Community Foundation, which then allowed us to do some further work. We ran some training with midwives, and that was quite, the results we got from that were quite astonishing in as much as the level of knowledge was quite low around Healthy Start vouchers, on what they could buy, how much they were for, and that sort of things. Every workshops, we are delivering a holiday lunch programme in a couple of areas of the city, and really focusing on a participatory model of that. People are involved in cooking, making lunches, running workshops at the holiday lunches, that type of thing. I think what's already been covered is the data. It really works. People have no idea that the level of food poverty exists, particularly in a city like Cambridge. People really have no idea that there's a life expectancy difference of about 10 years between the richest and poorest parts of the city. And many of you may have caught the Dispatches programme, came out last week before, that featured a family in Cambridge, which caused quite a shockwave through the city. So yes, we were really lucky in the way that Brighton and Hove engaged students to have a great PhD student who wrote a report into food poverty and poverty in the city, which that was really the basis for us starting our whole action planning and awareness raising around the issue in the city. In terms of our alliance set up, we have a steering group and then we have members. So we really wanted for this to be a community-led alliance. So we were, when we first set up, we purposely invited community champions to be on that steering group. So, and representatives from different sectors of the city. So church leaders, community development workers, that type of thing. So, so yes, I've got here, be the glue. There's a lot of people out there doing lots of things already. And we really don't need. Oh, our screen's gone. Is everybody ready? Is the screen okay with you? That's it. Sorry about that. So there's existing networks out there, and actually a lot of people are doing a lot of stuff around food poverty and poverty in general, and actually it's about learning from those networks because a lot of them have been going a long time and there's a lot of knowledge there. I'm going to run out of time, I know. The lessons we have learned over the past year, it's very easy to get caught up in the strategy and the writing the action plans and the higher level stuff. And I think for me, one of my lessons is to remember to actually get out there and speak to people. My background is particularly in community engagement and delivery. And so actually getting out there and talking to people, doing interviews or running the odd cookery workshop or whatever it is, and actually just to be human, listen to people and listen to their stories, and that leads me on is telling people stories. It's often just a snippet, it's often just a small single line that really can engage and tell the story to a wider audience. So I really feel passionately about amplifying those voices. I mentioned before that the City Council has completely endorsed our action plan, and they do have an anti-poverty strategy, which we are hoping that the action plan will be written into. So that's about sort of embedding a legacy. So if we all fall over next year, at least then there is a legacy for the city there. And I think something that Emily said earlier for her New Year's resolution around climate change, for me, and I guess Casey mentioned it, it's about this framing. Food is a vehicle or is the lens in which we are tackling a wider societal or systemic issues. So it can often be helpful to frame food poverty, depending on who you're talking to, through different lenses, and be that Brexit or climate change, or this idea of citizenship, or the wider social justice movement, because it goes across all the sectors. So yeah, let me just go the next slide. There we go. So here's some of our achievements. I'll throw some pictures in. There's a lot of things going on in Cambridge around food poverty. We've been running stuff around a Healthy Start. We have a community fridge, which sits in a community cafe, which is set up to support people with mental health and recovering from drug and alcohol addiction. We run concrete workshops. We developed an emergency signposting toolkit. We have an online map of all the food provision in the city, and there's just some pictures there of some of the classes, some of the holiday lunches, and also some of the consultation that we did for our action plan. In the end, we talked to and we interviewed and we gave out questionnaires to over 400 or 500 people in the city to put our action plan together. Okay, I'm running out of time. The last two won't take. So the challenge is we're all stretched. So meetings are difficult at times, and we've found that having a piece of work is good to provide focus for the steering group. I find that the media agenda changes, so it's either 1 minute it's food poverty, or the next minute it's climate change. It's almost like the media are unable to see a wider frame for this. So it's for me, it's about plugging it through radio and interviews, but keeping it through the current framing. I've mentioned our specific thing around sort of county versus city agendas. My New Year's resolutions, let's just keep going, and obviously we might have a very changed political landscape after Friday, so we will see. And in terms of the peer mentoring is to keep networking and get out into the eastern region and find those networks. Okay, thank you everybody.
Thanks, Sam. Sorry, we were just getting her to whiz through those at the end there, but I just want to make sure there was time for any questions, which hopefully there are some questions coming in. If you have any questions, just type them into the left-hand side there. Simon's put out the idea of other people sharing their New Year's resolutions with me, but I'm not sure if people want to share it. Mine have to do with fermenting food, so I'm not sure if that's applicable here. But if there's any questions for things happening in Wales or about Emily's bite-sized training or around Healthy Start or things that Cambridge has achieved, I should note that some of the stuff that Sam mentioned around Healthy Start and working with midwives is available now in our Making the Most of Healthy Start toolkit, which is available on the Food Power website under publications, which puts together a lot of the learning that different groups have had around the best ways to improve uptake and awareness of the scheme. And I think also includes a case study from Cardiff around their train the trainer model, and trying to streamline questions around food poverty into advice services. Emily has noted that the speakers must have all been very clear because there aren't any questions, which is what it's sounding like. If we don't have any other questions, then what we can do is leave the chat open for a little bit longer in case anyone wants to connect via the chat. Are there any other things that Katie, Emily, or Sam that you wanted to jump in with based on hearing the other presentations? If so, just turn on your mic and interrupt me. Feel free to.
Just to say, it's great to hear all the good work going on, and how much we've, all got in common, really, isn't it? All facing the same challenges about not having enough resource. So it's good to hear people's tips about how you manage to do the most with the least.
Yeah, I would definitely agree on that. And some of the other work I do at Sustain, separate from Food Power, has been around improving healthy, affordable food options in retail settings like convenience stores. And it's interesting, the tips that are coming through here are actually really similar there. They were just, a lot of it was about like, that was mostly within local authorities, and they're saying, what are the agendas that already exist? Is it obesity? Is it health and well-being? Like, what are the kind of strategies that exist within councils, and how can you align the work that you're doing with those existent strategies in order to get the buy-in that you need to kind of embed stuff over the long term, like you were saying, Emily?
I think I'm going to jump in. I think it's been invaluable to have the food power framing. I think for us in City, we've as a city, we've always had, we've got the food banks, we had a holiday lunch programme, we have other things, but there were just to be able to pull all those partners together into the same room has really meant some interesting collaborations that are happening outside of that steering group between the steering group partners. So I think having the framing of the Food Power and the Food Poverty Alliances has really helped us as a city to focus on the issues.
That's really good feedback. Thanks, Sam. That's useful. That's definitely one of the things we've been aiming for is, yes, kind of giving some structure to the work. Often what people find when they're starting alliances, I think, is there is loads being done. It's just how to improve the coordination among those different groups. I was talking to someone this morning in Northern Ireland who's listening in right now, but was just talking about, like, you know that there's a lot of stuff out there. It's just a question of how do we make sure that everyone knows about what the other ones are doing. So it's good to hear that some of this can provide that framing for it. Emily was
Maddie,
oh yeah,
it's Katie here. Emily Fay was asking about list of data sources. So I just wanted to say that the call to action report is on the Food Power website. I think for us, one of the really interesting data sources are the data sources on uptakes of benefits and schemes. So some of those schemes might be local things. Or national stuff that's supported through the social security system. One of the things that's quite powerful for us that I mentioned that's not necessarily applicable outside Wales is looking at the uptake of free school meals, which is one thing, but then looking at the uptake of free breakfasts, which is universal provision for primary schools, the uptake of breakfast by those children who are eligible for free school meals, showing quite how marked that gap is. And so, within the current system, where are the opportunity to optimise, those current benefits that are available to people? I think that's the kind of data that we felt is most valuable, because you can, at a local level, it's not something that necessarily needs national action.
Yeah, that's a good point. Figuring out, like, yeah, where can you get local data or data that's localized enough to have an impact with people and have it resonate, and then you can also action on it. And I think, like you're saying, those statutory national schemes like free school meals and Healthy Start are really useful, because the work around improving uptake can be done locally, while you don't need to wait. And despite the problems they have with them, like Emily was saying around Healthy Start, there is still work to be done at that local level, which is quite good for the local partnerships to work on.
And just so we went for a mixture of data. So yes, that sort of data around Health Start uptake or free school meal uptake or food bank use in the city. But we also went for doing some questionnaires throughout the frontline provision. So using the FIES, the Food Insecurity Experience scheme. Which was a series of yes or no questions, and we found that people really liked the feedback for doing those questionnaires was really good from particularly a couple of people at the homeless shelter that we interviewed, because it specifically wasn't asking them about their past or asking them to go into too much detail about their lives. It was simply a yes or no question. So I'd recommend people have a look at that. The FIES set of questions.
That's called the FIES scale, the Food Insecurity Experience.
Yeah, I'll drop a link in.
Yeah, and Simon has posted up two things there. One is the report for the South Wales report, which is on there, that we have on the Food Power website on the page for South Wales Food Poverty Alliance, the one done with Oxfam Cymru. And also we have a publication called Developing Food Poverty Action Plans that has a list of other data sets to look at. And if I recall, Emily in Shropshire has also done some great work on this, with mapping issues around food poverty locally in the county there.
Can I just add from Brighton and Hove as well, just to say I kind of I think part of the problem is that there isn't just an easy access load of data about food poverty. It's not something that is measured. So one of the things that we feel we've had to do locally to find ways to measure it, hence asking other organisations to ask questions, whether that's in a formal way, like through the annual City Tracker question, or asking voluntary groups to include questions in their monitoring, just to understand the food picture amongst their own organisations. And that's been really useful. And in fact, the organisations themselves have found it useful as well to understand what's happening at home. Are people sort of skipping meals or skimping on healthy eating? It's actually given them a better understanding as well. And I suppose, we've also done focus groups with particular groups of people as well to understand them. And one of the main things that's come out of, I think, those exercises is actually, it's not always just about figures. It's also really important to get some stories and understand people's actual lives. And I think stories are often as important as the data.
Yeah, that's an excellent point, Emily. And on your first point around it's not measured as, the elephant in the room a bit is that nationally, household food insecurity is not measured currently in the UK. And so when people talk about finding local data, it's about looking at different indicators and how they can try to begin to paint a picture of where people might be experiencing this and to what degree. And like Katie was saying, looking at things like benefit uptake is a good way of measuring that, and then some of the other things that are in the food poverty action plans of ways of measuring it. And Simon might be able to find the link and share it with everyone, but there has been a commitment by the UK government to start measuring it, but I'm not sure which year it is. Does anyone else know who's listening in? I don't think it's 2020, but it might be 2020 or 2021.
It's this year, Maddie.
March, I believe.
It is in 2020.
I think it might have even started this year, but if it's not this year, it's certainly next year.
Okay. Do you know? Are you able to share any of the details of that? I feel like I'm too fuzzy on it. I don't want to misrepresent the.
Yeah, I can send you the link, Maddie, and then you can send it around.
Okay, yeah, I just don't have it. Or if anyone else knows and wants to share what that is, but I just can't. I don't want to. But I know they have said they will start measuring it nationally, but I don't think we'll have any of the data on it for quite some time because they incorporate the questions into national surveys and then they analyze it and then we get it months later. But there is a bit of movement on that, which everyone, many people are feeling positive about because, as someone said earlier in the webinar, what gets measured gets fixed. And so that was a big campaign when hearing that the UK government was committing to that, but we might not see the benefits of it for a little bit of time. So in the meantime, the local data is quite useful. A few other people have shared some of the links in the chat box. We're just coming up to 11:30 here, and I haven't seen any other questions coming in. It looks like, they're sharing the results of some of those news items there around around the upcoming national measurement and other things around locally. Emily's just commented that it's not actually reporting to March 2021. So I think they're starting to measure in 2020 and then we'll get some of the details into March 2021. Thank you everyone for listening to the webinar today. Thank you in particular to Emily, Katie, and Sam for sharing your experiences and some of the things you've learned over the next year. As I mentioned, Emily, Sam, and Katie are 3 of the peer mentors with Food Power and do organize regional and thematic learning network meetings around the country in their different regions. And we'll be having more of those in 2020 through March 2021. And we'll be sharing a schedule, sort of an annual plan schedule calendar with everyone in January, February of the new year about those regional and thematic meetings that people who are members of Food Power are welcome to join. So stay tuned for that. And of course, we'll have more webinars coming up in the new year as well. If you have any topics that you'd like us to cover or people that you'd like to hear from, do get in touch with me as we're very open to different topics being covered here. And I'll be sharing the link to these slides and the recording with you later. So I'll leave the attendee chat open for a little bit, but thanks again, everyone, for joining us today and have a great holiday season.
Thanks, Maddie.